Hello and welcome. I am Dr. Snehal Mallakmir, Consultant Clinical Geneticist, Apollo Genomic Center, Apollo Hospitals, Navi, Mumbai. Today I am talking about importance of genetic testing. Genetic testing usually includes testing of hereditary material which is present in the form of chromosomes and DNA, that is gene testing. But it is not as simple as we do routine testings. Routine tests are available over the counter. Sometimes patients go and themselves can ask for it with sufficient information. Nowadays, some of the genetic tests are also available over the counter, but the risk is high, and we should know what is importance of genetic testing, where it should be applied, what are the limitations, so that we should seek an expert opinion whenever needed. Genetic tests are of various types. When we study chromosomal material, we can do a karyotype, a simplest investigation, or a microarray, which is a little advanced investigations and little costlier. And when we have to study genes, we have various gene sequencing platforms like exome sequencing, gene panel, genome sequencing. And there are other tests specific for specific problems like fluorescent in situ hybridization, that is FISH, which is commonly called as. And there are other methods like MLPA for which certainty of the diagnosis is needed. So we are not going to go into details of the genetic test, but we are just discussing importance, because the genetic test, the prescription and taking of genetic tests need some prior information and some preparation for the patient and the family. Like, we have to have a pre-test counseling, why this test is being advised, and how it will benefit patient. So benefits of genetic testing are usually confirmation of the disease, so that there is a certainty made many times, because genetic diseases are difficult to understand or difficult to reach a diagnosis at many places because of lack of expertise. So there is a stop given to patient queries about disease if the disease is confirmed by genetic testing. So that is the biggest advantage. And other advantages are whenever some diseases are treatable or modifiable, the treatments can be started early if the genetic test provides you a final diagnosis. Also, other advantages, because genetic diseases are usually, as we understand, is a disease related to hereditary material. If there are other family members at risk, we can give a prior information. Sometimes the disease is so risky or so severe, so we can have the information, we can give the information to the family for further planning the family, taking their pregnancy decisions. So these are the basic and important advantages of genetic testing. But along with it, also sometimes predictive risk, like in cancers. So we have diagnostic tests, we have predictive tests. In diagnostic test, as I've said, that we can diagnose the disease precisely for precise management and therapeutics. Predictive can be given in some of the individuals, where we can detect them before, in early stages or before the symptoms arise, or to provide the risk, so that we can have some screening for the disease, so that we can prevent the disease from occurring or complications. And we have pharmacogenomic testings and other testing which are applied in that particular setup. So importance of genetic testing should also be understood in the framework of limitations of genetic testing, because the genetic tests are costlier and each test has its own limits. So these have to be discussed in pre-test counseling, so that patients and families are well aware before taking the test. In case that particular test is not able to give you the final answer, which are the further tests which are likely to give you the further answer. That is what is done in pre-test counseling. And once the report comes, we have post-test counseling, where we explain the report to the patient, whether the diagnosis is reached or not, what is the final diagnosis, according to the diagnosis, what is the management of this disease, what is the prognosis, that is the idea of the progress of the disease, and what are the treatment options or modification options or management options available to patients, and in case planning for the family or advice for family members. Apart from this, genetic tests have evolved rapidly and the platforms are changing very rapidly. So sometimes a single test is very likely to replace many tests. Like nowadays we are seeing in exome sequencing and genome sequencing. So sometimes it may be better, even if the test is costlier, it may be better to take a costlier test than do multiple testings like single gene testing. So because the platforms are evolving rapidly, we should also know the advantages of this testing, and also costing are also changing rapidly. So in all these setups, we should understand how and where the genetic testings are applied in children, in adults, in cancers, and in pregnancies. So the genetic testing, even if looks, because nowadays information and awareness is increasing, the genetic tests are quite easily available than before. The genetic test should be understood well for its limitations, for their advantages, benefits, and also sometimes risk posed by testing, like emotional well-being of the patient and the family, psychosocial importance and impact of the testing after the diagnosis of the disease. Hence, at Apollo hospitals, at Apollo Genomic Institutes, we have pre-test postage counseling in place, and we take care of it, that we give complete information regarding genetic testing before patients take it, and that expertise is needed wherever patients are likely to go ahead with the testing. Hence, for any queries regarding genetic testing, please visit the center, and you can have appointments and online appointments at our page and visit this page. Thank you.